Imagine breathing in a simple gust of dust, and weeks later finding yourself with a serious illness that feels like the flu but can last for months. This is not science fiction. It is happening right now in California. The disease is called valley fever, and in 2025, cases are reaching record-breaking numbers. Valley fever, also known as coccidioidomycosis, is caused by a fungus called Coccidioides. This fungus lives in soil across parts of California. When soil is disturbed by wind, farming, or construction, microscopic spores can be released into the air. Breathing in those spores can cause infection. In California, reported cases have been climbing dramatically. By the end of July 2025, the state had already recorded more than 5,500 provisional cases. Last year, 2024, there were about 12,500 cases, the highest ever reported. Over the last 20 years, the rate of infection has risen by about 800%. Even in coastal and Bay Area counties where cases were once rare, the numbers are rising. Contra Costa County has reported 105 cases, and Alameda County has reported 72 cases so far in 2025. Symptoms usually appear within 1 to 3 weeks after exposure. They often resemble the flu or pneumonia, fatigue, cough, fever, night, sweats, muscle or joint pain. Some people also develop shortness of breath or a skin rash. Most healthy people recover without medical treatment, but certain groups are at higher risk of severe illness. These include adults over 60, pregnant women, people with weakened immune systems, people with diabetes, and individuals of African or Filipino descent. Outdoor workers in agriculture and construction who spend long hours in dusty environments also face greater risk. Doctors diagnose valley fever using blood tests, chest X-rays, or CT scans. In more serious cases, a biopsy may be needed. Mild infections may go away on their own. But serious or long-lasting cases require antifungal medication, most often fluconazole or itraconazole. For life-threatening cases, doctors may use amphotericin B. Treatment usually lasts 3 to 6 months, and in rare cases much longer, especially if the disease spreads to the brain or central nervous system. Prevention is focused on avoiding exposure to dust. Staying indoors on windy days, wearing N95 masks when outdoors, using HEPA air filters inside the home, and wetting soil before digging are recommended protective steps. At present, there is no vaccine for humans, though scientific research is continuing. Valley fever may begin with symptoms that look like the flu, but for some people, it can lead to severe, life-altering illness. Cases in California are at record highs, and even counties near the Bay Area are now reporting growing numbers. If you live or work in dusty environments, awareness is your first line of defense. Recognizing the symptoms and taking precautions could make all the difference. Valley fever is a hidden danger in California's soil, spreading silently through the air we breathe. The numbers are rising every year. Stay informed, protect yourself and your family, and if you found this video helpful, please share it with others. Don't forget to subscribe for more health updates and trusted information.